Good morning. Is this on? Oh, yeah, it is on. Okay. Hi, everybody. Welcome to our first in-person hearing in, what, like 18 months. It's amazing.
All right, senators and Senate committee members. My name is Mildred Garcia Gallery. I'm a proud Latina. I have been a home care worker for more than 30 years and the founder of Ageless Companions, a Long Island-based staffing agency. I was introduced to home care at 19 while I worked for United Cerebral Palsy. One client, a young man in particular, named Theory, truly impacted my views on home care. He was wheelchair-bound, and he was in a special program for eating. One day during lunch, he began to choke, and he turned blue. Although I was scared, I jumped into action. I suctioned him, dislodged the piece of food, and thank goodness he began to breathe. We both sighed in relief. I was shaken, but I felt capable and competent, and I hadn't felt that at that age, at that time, and it really gave me direction. It made me want to do better and be better. It changed the direction of where, or the projection of where I was going to go in life, because I was not one of those, my circumstances did not allow me to go to college directly out of high school. So home care actually saved me in a sense. I'd like to continue on. So I continue to provide the best possible care for all of my clients. One of the most memorable clients was Ralph Cipriani, a 95-year-old World War II veteran, and his wife, Christine. Ralph, when I met him, was 98 pounds, but his will to live was as strong as my will to care for him. I learned much about life from Ralph. I learned about patience. I learned about the value of human contact and human interaction and how much that does feed and nurture a person. Together we worked tirelessly. His doctors were impressed with the amount of progress he made in such a short period of time. Our growing friendship encouraged him to fight a little bit longer. Unfortunately, Ralph lost his battle, but on his own terms, at home, with dignity, with love and support, and I was proud to be a part of it. And I'm proud to still currently care for his wife, and they were married for 71 years. And anyone knows, being married that long, a loss like that can actually take you down. But it didn't, because she has us and we have her. This has been my life's passion, my life's work passion. But with the low pay, I wonder every day, how can I stay? How can I continue to stay in a profession that does not value me? How can I support my family, my 3 daughters? I'm trying to put them through college. This work makes me feel wonderful, but it doesn't pay the bills. I know that I am one of thousands of people who love home care work. But we're feeling forced to leave a profession because of its low wages. So I am here to ask you, to beg of you to say this is the time. We need it more than ever. The families need it. They need our care, but we need to be cared for. To go on to continue to care in a way that you care for your own family, but yet to go home and to come home to your own empty pantry. To not be able to provide for your children the things that you want, that you see maybe the families that you're caring for. And it really is about the humanity. I feel that we have lost that sense of humanity, where possessions and things mean so much, and at the cost of our loved ones' lives, of how we care for them. We have got to put that first, because without human compassion and us coming together to solve this problem, I don't know what else is going to happen. I don't know who else to ask for. We have exhausted every area, and this is a job that I and many others are so proud to do. And there are all these misconceptions about us, and those are stigmas, and that's not the majority of us. It is the minority I speak for for all of the ones that love to do this, and we don't want to leave. We want to stay and do this work that we've been doing for long, or people that just came into it. We want more people to come and join us, but they're not going to for this pay, when they can go to the food, Holly Lobby or wherever and make more money. So what are we saying? That the value of our loved ones is not that much?
Thank you. Thank you so much. Thank you, all of you, for just reminding us how important this is. We're up to panel 8, Dana Arnone, the Honorable Christine Pellegrino, Peggy Horowitz, and Jim Hurley.
Thank you.
Let's start with Dana.
Okay. Thank you very much for the opportunity to sit before you and have this conversation that's been very, very long overdue. My name is Dana Arnone. I am a former home health aide who put herself through Suffolk Community College. I am a registered nurse for more than 30 years. I am a proud owner of Reliance Home Senior Services, which is a small LICSA with about 300 home health care employees, and we are proud members of 1199 Unit. And I'm very happy Rhoda's here, and she's on my side. So, my history as a former nurse's aide gives me a unique perspective and understanding, as well as a great empathy for both the patients and the employees. I've devoted my entire career and my life to home health care and its total reform. I'm here in solidarity with the caring majority, and I stand with my employees in support of fair pay for home health caregivers. It is beyond frustrating that we are sitting here debating the concept of human infrastructure. It's unbelievable to me every time I hear that bus drivers may receive $23 to $26 an hour, your fast food workers receiving $15 an hour, and we have to beg for our aides and our workers who care for human lives to make at least a living wage. The pandemic has brought to light many issues that have been swept under the rug for years. The most important being that there's just not enough caregivers for the number of homebound patients. The need is growing exponentially, and it is only going to get worse unless extreme action is taken. It really is the perfect storm. A recent statewide survey of home health care agencies found that about 23 positions were left unfilled due to staff shortages, and as a result, agencies have been unable to accept nearly 30% of new cases. How are we, the agency, supposed to survive? And I just want to add, as I'm sitting listening to the testimony in my office, I'm having a conversation with the director of my office, and from today until this weekend, we are down 50 workers that we have to staff the cases, and we don't have them. So what's going to end up happening is we're going to end up calling our families that we care for, that they're going to have to step in and either take care of their patient, of their loved ones, or go to work or abandon them. So we have this constant, we sit there and talk to them every week, and we're begging them to stay with us and ride through the storm together. Once they hear that we can't staff their cases, a lot of families think that there's going to have more opportunity for workers on other agencies, and then they find out that it's the same situation across the board. So that's just as I'm texting back and forth, I'm listening to them, they're like panicking in the office. We sometimes stay there till 8, 9 o'clock at night trying to staff these cases for our families, and it's impossible. So let me just go back. So with the decrease of the employees, that we still have to care for our patients. Overtime in my office is up about 20%. It is unsustainable. So you're going to find more and more agencies, especially small LICSs like myself, they're going to be closing. The governor constantly references that we are New York tough, but we really should be New York cares. Mm-hmm. I find it completely unacceptable that across New York State, I'm going to cry, the elderly, disabled, and homebound are going without water, food, medication. They're not being dressed, bathed, and they lack basic human contact. People wonder why we have such a high rehospitalization rate among this population. They are not being cared for. I can attest that my agency is doing everything that we can to retain and attract home health aides. Reliance, my company, provided an extra $2 an hour to each aide as soon as we were granted the PPP funds. We participated in the 1199 Union's successful transportation pilot program, which they're still, my aides are talking about. We Uber aides to hard-to-staff outlying locations just to provide safe, consistent care to our families. We provide scholarships to PCA school for those interested but unable to afford the certification. I myself have gone so far to start a not-for-profit called All Things Homecare so that we can help other small agencies like myself and that are experiencing the same issues. We celebrated our home care workers every day when they were mostly forgotten and abandoned by the media. Home health care givers are essential to the most fragile, the elderly and the disabled. The homebound deserves to be in their home and deserve consistent care. We need to acknowledge that people matter, the patient as well as the caregiver. There's no one more essential than that worker who's caring for you in your home. We believe that there needs to be fair pay for differentials on Sundays and holidays because these are the most nearly impossible times to staff, and the burden falls upon the agency. We believe that nursing students should be rotated through home care. As we at Reliance, we took it upon ourselves. We have developed a syllabus. We presented to Farmingdale State College, and we are ecstatic to say that nursing students will be starting their clinical rotation through Reliance Home Care this fall. In addition, we feel that it's valuable
I have to ask you to wrap up, Dana.
What? Wrap it up? Oh, okay. In addition, we feel that it's valuable that, this is actually really important, we just made my last point, that there is a opportunity in nursing students when they're going through the first year of nursing school. They are completing fundamentals of nursing, which is basically the core curriculum for the PCA and Home Health Aid Certificate. If we can just tap into those nursing students, we can have an immediate workforce, we can have a valued workforce, and we can start the nursing students to begin their opportunities in home care, and really starting to change the perspective that they have. Thank you.
Christine? Just touch it very lightly.
One thing you could do is to start talking as
Yeah,
you
got it,
as you start talking.
There it is.
There
Okay,
you go.
I'm on. Senators, thank you so much for being here for the long haul. We understand that it's been an extraordinarily long day and hopefully very productive. We're grateful to you for working together to hear about this topic and for giving me the opportunity to provide testimony. My name is Christine Pellegrino. I'm a former member of the New York State Assembly, a mom and a daughter to aging parents. I am currently the board president of All Things Home Care, a not-for-profit dedicated to improving the lives of the elderly, the infirm, and the disabled. All Things Home Care seeks to work collaboratively and creatively to support and elevate the role of home care workers to improve their quality of life and ultimately make a difference in affecting patient outcomes. We believe that everyone should be able to receive the care that they deserve to live a life of dignity, which makes the shortage of home care workers a real crisis for parents, patients, their families, and ultimately for us all. The shortage of caregivers creates a cascading effect on families and communities, detracting from the overall productivity of the local workforce. When cases can't be regularly staffed or caregivers unexpectedly miss their assignments, care, as we've heard often today, for the patient falls to a loved one who must choose between their family member and their job. We cannot ignore the pending workforce shortage any longer as the crisis is already upon us. Unstaffed cases and missed visits are a direct result of some of the various issues home care workers face, and I'd like to talk about that a little bit. Namely, home care workers face significant barriers that limit their participation in the workforce. It's often said that it is expensive to be poor. Often, home care workers rely on public transportation. Now, if you've ever been to or been forced to commute by public transportation anywhere in the suburbs of New York, particularly on Long Island, you know how woefully insufficient our suburban public transit system is. Furthermore, roughly 25% of Long Island patients live in areas that are deemed hard to staff because they are not accessible to public transportation, thus resulting in a situation where the patients who need essential care in their home have great difficulty receiving it. And so, the intersection of a subpar public transit system and low wages means that workers must choose between spending their personal time on a labor-intensive, hours-long, exhausting commute, the unaffordable cost of rideshare options, or simply not working at all. The reality is that suburban home care workers may be forced to accept fewer assignments than they could because of their low pay, thus magnifying this crisis. Our organization, All Things Home Care, has launched a private transportation initiative for caregivers who need a ride to work because it gives the caregiver the ability and the incentive to accept work, and importantly, they are able to keep more of that money in their pocket. Therefore, All Things Home Care is calling for the historic investment in initiatives that offer a broad range of support systems for essential workers. We also, as many have, support fair pay for home care legislation because we believe that those who provide essential care should not be relegated to a lifetime of poverty. We support Senator May's Home Care Jobs Innovation Fund and support appropriation of the $15 million immediately from the Federal CARES Act funding for initiatives like our Home Care Worker Transportation Initiative, as well as funding for childcare, broadband, cellular service, and other workforce-related expenses. This innovation fund will create jobs in the human service sector, such as drivers and childcare providers, and we encourage the unionization of those workers as well. Finally, in order to support home care agencies, often locally owned small businesses who are themselves significant job creators, we call for an industry-wide pay rate standardization and a raise to the reimbursement rate to include the overtime pay and holiday pay for caregivers. Agencies, as we've heard today, operate on very small profit margins and need to be compensated in a way that allows them to, not just to operate, but to thrive. Thank you.